right, good day, everyone. My name is Paul Owusu-Oduro, and I'm presenting on the topic assessment of Ghana's progress towards attainment of Millennium Development Goal 6. And this is a review of Sentinel Survey reports in Ghana. Is it better?
Please go ahead. Thank you.
All right, good. So a little background to HIV infection. We all know that HIV it's a global phenomenon because of the devastating effect of the ailment itself and then the economic impact it has on any nation. HIV was first diagnosed in Ghana. Yes, sir. Oh, there. Now me yes Skype call me. Hello. 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 Since its confirmation in 1986, the infection has spread throughout the country and it's now well established in the entire society. The national HIV prevalence as at the year 2015 stood at 1.3%. The country is divided into 10 regions, and Greater Accra region happens to be the capital of the country and the seat of government, and that recorded the highest prevalence as at the year 2015. Millennium Development Goals are a set of target-bound goals that 191 countries in the UN adopted to and committed to work on and then improve the living conditions of their inhabitants. The Goal 6 specifically targets HIV and AIDS with sub-targets as 1, to halt by 2015 and begin to reverse the HIV/AIDS infection, and also to achieve global access to treatment for HIV/AIDS for those who need it by 2010. Following the declaration of the commitment of the UN General Assembly Special Session on HIV/AIDS in 2001, the government of Ghana committed 15% of its health budget to fighting HIV/AIDS activities in the country. Ghana is a developing country, so resources are quite scarce, and it's imperative as public health personnel that any intervention that we commit resources to, it has to be evaluated to know whether it's making impact or not. The aim of this study was therefore to review Ghana's progress as far as commitment to reducing the infection of HIV is concerned. And I reviewed HIV Sentinel Survey reports, which is generated annually as a proxy for the HIV epidemic in the country. So the HIV Sentinel Survey is a cross-sectional survey which targets pregnant women attending antenatal clinics in various antenatal sites in Ghana. The surveillance system was initiated in 1992, and since then that has been the main source of data for HIV prevalence in the country. The reason why pregnant women are used as a proxy is based on the fact that they represent a good proportion of the spread of infection in the country. To ensure a balanced representation of the HIV infection in the country, the Sentinel Survey sites have seen a gradual increase since it started in 1992. Currently, the number of Sentinel survey sites is 40, which is evenly distributed among the rural and urban populations in Ghana. So, the result, because the interest is to assess Ghana's progress towards the achieving Millennium Development Goal 6, Target 8, which is to halt by 2015 and begin to reverse the spread of HIV infection, I use the median HIV prevalence in the country. I started from 2001 because the Millennium Development Goals were declared in 2000, and using 2000 as the baseline wouldn't really be much useful, because by then the government had not really started any serious activities towards reducing the spread of HIV infection. So starting from 2001 means we gave the government a whole year to put in measures to be able to start measuring the impact of those measures on the prevalence of HIV infection. So the initial one, the earlier slide, let's go back to the earlier slide. You will see the HIV prevalence rates from the year 2001 up to year 2006, and it's linked by this linear graph. The second slide on results represents the prevalence among various age groups within the country. The individual points are also nicely joined by line graphs, and we'll talk about that in the discussion. You all agree with me that HIV prevalence data is very critical for planning any intervention program. This study reviewed the national HIV/AIDS and then STI infection control program data of the Ghana HIV epidemic over the period 2001 to 2015. And the aim was to assess Ghana's progress towards Millennium Development Goal 6A, which is to halt by 2015 and begin to have reversed the spread of HIV/AIDS infection. The linear trend analysis from 2001 to 2015, as depicted in Figure 1, shows a declining HIV prevalence, and therefore effort and measures that were put in place can be said to be working and should be encouraged or intensified to further achieve better outcomes. This review also showed that HIV prevalence was highest among the most economic productive age group, which is 20 years to 49 years. And this agrees with most global trends of HIV infections across the world. From Figure 1, you could tell that the HIV prevalence in Ghana remained fairly steady from the year 2009 to 2012. Between 2013 and 2014, the country saw a sustained consecutive decline in HIV prevalence. And this gave everybody the assurance that the country was actually on a good footing to reducing further the spread of HIV infection. The decline could, however, not be sustained, as there was a sharp increase in the prevalence from 1.6 in 2014 to 1.8 in 2015. The 2016 HIV prevalence data, which is yet to be published, also paints a scary picture for the country, as it saw a further increase from 1.8% in 2015 to 2.4% in 2016. At this point, one will ask, what has happened to the gains that the country made in trying to bring under control the spread of HIV infection? From the study, we could attribute this increase in prevalence to a number of factors, but the prominent one among them is the lack of resources to be able to continue with the campaign against the fight of HIV infection. Globally, we experienced some global economic downturn As I said, Ghana is a developing country, and about 30% of our national budget is supported by external agencies. So if you are not getting funds from these external agencies, then definitely most of these activities which rely on donor support will be hampered. A couple of years ago, we were seeing a lot of advertisement on the devastating effect of HIV infection and its economic effect on the nation. You could see this in the electronic, the print media, almost everywhere. Campaigns were being targeted at this economically productive age group, that is from secondary school to tertiary institution, to make sure awareness are created to instill the right sexual behavior in them. But because of this economic downturn and the lack of resources to promote this campaign, it's like everybody is resting on its oars. And because this targeted age group are quite sexually active, it is quite difficult to instill a good sexual behavior in them if you don't constantly remind them of the effect of HIV/AIDS, which definitely will need money to run those campaigns. So I strongly believe that the decline, which was not able to be sustained, was as a result of lack of funds to fuel some of these HIV programs. And this was confirmed by the Vice President of the Ghana AIDS Network in Ghana in 2015, when he made a claim on a national platform that most of the international agencies and NGOs which were committed to the fight against HIV are folding up because they have used up all their resources and none is coming in to help support activities. Because financial support is dwindling, it is therefore imperative that the local government and agencies find ways of committing resources to champion some of these activities, which will invariably end up reducing the spread of HIV infections in the country. In conclusion, I would say Ghana has been able to meet the Millennium Development Goal 6 on HIV and AIDS. The reason being that the country started with a national prevalence rate of 2.3% in the year 2000. And as of 2015, the national prevalence stood at 1.8%. If we look at that particular target, what it said was for the nations that have committed to the MDG goals should be able to halt and begin to reverse the spread of HIV infection by 2015. So if we are evaluating the Ghana's progress on this, then we will say Ghana has been able to achieve MDG Goal 6 as at the year 2015. But even though we've made great strides in reducing the HIV infection up till 2015, current trends are worrying, especially from 2014 when we began seeing the rise in the prevalence, and that rise has been sustained as at 2016. It is important that the country looks at measures to be put in place in order to bring back on track whatever it did to make sure that some sustained declination was seen in HIV prevalence in the country. Thank you all for listening. This is the end of my presentation.
Thank you, Paul. Thank you.